Hello and welcome to our review today. Today we are looking at the course outline for gynecological nursing. Gynecological nursing is a two-unit course, and gynecological nursing, this will be involving the OBS-GYN nurses. These are just registered nurses who simply work alongside the OBS-GYN physicians, and their role is just to provide prenatal, postnatal, and reproductive health care to female patients from puberty to from puberty during and after pregnancy and through menopause and beyond. They simply assess and triage patients and treat all female health issues. So this course requires you to have covered human anatomy, human physiology, and pathology. The major purpose for this course is to equip you with the knowledge, skills, and attitudes for competent management of patients with gynecological conditions, health, sexual health issues, and contraception. So this course will involve both theory and practicals. For the practical experience, it will be covered within 2 weeks of placement. The expected learning outcomes is that we expect you to be able to discuss the management of conditions causing early pregnancy loss. We also expect you to be able to provide sex education and health promotion to all the potential clients, providing also counseling services to patients and clients with these gynecological problems. You should also be able to describe the management of conditions that affect the female reproductive system. In addition, you are also supposed to be able to describe the different methods of family planning, both the natural, the conventional, and should be able to outline the advantages and disadvantages of both, and also help a patient decide on their method of choice. Lastly, you should be able to discuss the management of male and female infertility in the current century and be able to provide possible solution for that. In the course content, we'll start by the introduction to gynecology, where we look at gynecological assessment, both history taking, physical assessment, psychosocial assessment, diagnostic procedures, disorders of the female reproductive system. Then look at the reproductive tract infections, starting with the usual suspects, sexually transmitted infections, the classification, predisposing factors, clinical manifestation, diagnosis, management, complications, prevention and control. We'll also talk about the HIV and AIDS, immunology, prevention of mother to child transmission, reproductive health issues, services, so that we see the importance of integration of such services. All right. Also, we'll also look at some types of cancers, and this will be a continuation of the pathology class. So we look at the cancers that do affect the cervix, the breast, the prostate, the endometrial, the ovaries, the vulva, and also participate in cancer screening sessions like the Via Vili sessions, and also look at the advocacy for just awareness of among population so that they are aware of such a conditions. Lastly, we look at the disorders of menstruation like the amenorrhea, menorrhagia, premenstrual syndrome, infections, genital prolapse, the fistulas, the neoplasms. Of course, that will partly be covered under cancers. We have endometrial hyperplasia, uterine fibroids, ovarian cyst, infertility, menopause, breast disorders, ectopic pregnancy, abortion, and the post-abortion care, the PAC, the effect of abortion on maternal mortality and morbidity. And we can also look at the laws and regulations related to abortion, share the social, cultural, and religious perspectives of this, and the role of a nurse in abortion and counseling clients, and laws relating to termination of pregnancy, principles of sexual disorders, pharmacological treatment of this sexual dysfunction, rape, sexual violence screening, imaging for pre-malignant disease, and therapeutic procedures. For the practical aspect, you'll be placed in the gynecological ward for 2 weeks, and we want you to be able to apply the knowledge, skills, and attitudes in biomedical and clinical sciences, infection prevention and control, the nursing process, and the theories of nursing, so that you are able to conduct health assessment for patients with gynecological conditions. You should be able to develop and implement specific nursing care plans for patients with the following conditions, which are very common: disorders of menstruation, reproductive system, abortions, ectopic pregnancy, neoplasms, especially the ones relating to the breast and the cervix, breast disorders, obstetric fistulae, and also look at a patient who is supposed to undergo total hysterectomy. So at least you should have two patients for each conditions for you to have acquired the competences. We'll also expect you to be able to participate and perform, of course, with observation in various gynecological procedures, especially speculum examination and MVA applications. You should also be able to share health messages with patients and families on the various gynecological conditions that we have stated before. And finally, provide palliative care for patients and family with terminal illness. So this is our course for the semester. I'll request you to attempt the pre-test in the description section, just to assess how on and to what extent you have covered the human anatomy, medical physiology, um, for that matter, and finally pathology, which are key concepts and prerequisites for this course. Thank you so much, and see you.